Meanwhile, Health Minister Dr. Zweli Mkhize is pleased with the imminent arrival of the Cuban medical experts. The team of more than 200 which physicians and biotechnologists is expected to land around midnight. Mkhize says the Cuban medical brigade's experience with disaster preparedness and relief will assist the country's efforts. The brigade will be put in quarantine before beginning their work in all provinces. And to take us through the relationship between South Africa and Cuba, we are joined by our foreign editor, Sophie Mokoena. Sophie, a very good evening to you. Thanks for joining us. Welcome.
Good evening, Mpiwe.
Now, this has been a long-standing relationship between South Africa and Cuba. Do take us through the intricacies of this relationship.
You know that the relationship, you can trace it to exile years, where the two countries, before 1994, when the ANC was still underground and most of the leaders were outside the country, they strengthened the relationship then. And Cuba played a prominent role in the liberation of South Africa. We know that the former president of the ANC, late President Oliver Reginald Tambo, and the former president of the Republic, who later also became the president of the ANC, Thabo Mbeki, interacted with the former leader, the late Fidel Castro, on many occasions as they were preparing for the ANC to play a prominent role in leading the country. I remember Mbeki saying that at some point in time, they had to take the Freedom Charter to Fidel Castro, where Fidel Castro went through the document. And when he looked at the document, he advised them that on issues of nationalizations of banks and mines, they will have to train people who will be able to run those important institutions or sectors. It wasn't a surprise later when President Mandela, after he became the president of the Republic, he also visited Cuba, and they then agreed with Fidel Castro to take some South Africans to go to Cuba to receive training, mainly on health matters, but also you also have the engineers who get training in that country, and also some basic military skills in Cuba. And that program is continuing. We still have many students in Cuba who are receiving training in medical fields, but also generally in engineering and military.
Well, this is certainly not the first time that Cuba is assisting other African countries. Do give us other examples of where that kind of assistance was received in Africa.
You know that during the Ebola crisis, Cuba was the first country to arrive on the continent to assist the DRC and other countries that were affected, and later China did join. It's not even that incident. When Sierra Leone experienced a challenge of malaria, Cuban doctors went to Sierra Leone to assist. And we also know that some of the countries in the SADC region, countries such as Namibia, for the countries to be free, they got military assistance from Cuba. And therefore, Cuba has played a very important role pre-1994 and post-1994, but not only in South Africa, but in other African countries. Even to date, you have many countries on the continent who always send their students to Cuba for particularly the medical training. It is not only South Africa. You also have many doctors from Cuba on the continent who are working on the continent. The good thing with the Cuban doctors is that in terms of their training focus on primary health care. In other words, their main skill is prevent, not treat. And therefore, they are able to assist to build a better infrastructure and capacity for medical fraternity to ensure that you prevent the disease even before they can break in your country. And therefore, it's much better than having diseases and you have to deal with people who are already sick. And therefore, many people are really convinced that the training in Cuba is one of the best training, particularly for primary health care. Two, in terms of the socialism, the culture of serving the people. They don't question wherever they get deployed. they will agree to go. We have a problem sometimes where when people have completed their medical training, they don't want to go to the countryside because facilities and transport are a challenge. And therefore, for the Cuban doctors, they don't mind to go to countryside to work there.
I mean, this is one country with the world's highest ratio of doctor to population, and which is why they were able to prepare for the pandemic much earlier. And it speaks to the higher level of medical diplomacy that the country is world renowned for. But then it seems like not everybody is quite impressed with the Cuban medical prowess. I mean, the United States President Donald Trump has urged countries not to receive Cuban medical assistance. Let's extend our analysis into that kind of U.S. reaction of Cuba. I mean, to Cuba helping other African countries. Should it really be a tough balancing act for South Africa, because South Africa is friends with both these countries?
Well, if you remember very well, when former President Mandela came back from Robben Island and he visited the United States of America, he had to answer hard questions about ANC and the relationship with Cuba, with Palestine, and also with countries such as Libya. And it was former President Mandela who made it clear to the Americans that the Americans cannot dictate to South Africa who the friends of South Africa should be. He went further to say he will continue to have a relationship with Fidel Castro. He will continue to have a strong relationship with Libyan President Muammar Gaddafi, and also Yasser Arafat of Palestine. And therefore, that culture continued. Mbeki did the same thing. He continued to have a relationship with the U.S., but continued to support the Cuban government, and he even went on a state visit in Cuba. The former president, Jacob Zuma, visited Cuba and also attended the memorial service of the late Fidel Castro. The SACP was there during the funeral. That would include even the EFF. So the relationship between South Africa and Cuba is very strong. And Donald Trump is continuing with the culture of the U.S., where they have imposed embargo against that country, even though the former President Barack Obama, during the memorial service of former President Nelson Mandela, he tried to reach out to Raul Castro at the memorial. You'd recall the handshake, the famous handshake, and from there they started the diplomatic talks. But when Trump came in, he enforced the embargo, and he is continuing to do that, even though many countries at the United Nations have called for the lifting of sanctions against Cuba. Therefore, it's a political grandstanding typical of Donald Trump.
Now, Sophie, a delegation of ANC officials visited Cuba last year, and of all the kind of interactions they've had with officials there, they also, they were of the opinion that Cubans are actually suggesting that Africa, in particular South Africa, should get rid of these neo-colonialist mentality that, that is propagated by institutions such as the World Bank and the International Monetary Fund. And we've seen some time ago, Rwandan President Paul Kagame saying that a narrative about Africa should be changed, and also called for, or rather suggested, that Africa should rather print its own money. Since Africa is in the state that it currently finds itself in, and made worse by the coronavirus pandemic, can Africa really turn its back on these global financiers?
Well, you have to find a way to work with those institutions, but at the same time, they cannot perpetually make us slaves and send millions of Africans on the continent, to the brink of poverty. And therefore, you will have to find a balance. Last week, when the two institutions made an announcement or discussed the issue of coronavirus, they announced that they have put aside a special budget to assist in the challenges of coronavirus. And when you look at the terms of reference, or perhaps the terms for that kind of money to be granted to to countries or that loan, it has got better agreements contrary to your normal loan that you get from IMF and from the World Bank with huge interest. Therefore, as a country, the country must look properly at the terms of reference, terms and conditions of that kind of a loan, and check whether it will not cause problems for generations to come. But the Cubans are propagating a socialist type of government. We know that they want the state to intervene. They want most of the institutions and the important sectors to be under the state. But as you do that, you must have capacity and skills to do that. But one thing that coronavirus has done, it has really dealt with capitalism in a very shrewd manner, because most of the countries had to include some socialist policies in terms of state intervening in the economy and generally in assisting people. Some countries even announcing that they will nationalize the private hospital. And therefore,
Sophie, I'm afraid we have to leave it there because the Cuban ambassador in South Africa is ready to chat to our reporter, Criselda Lewis.